Hello, I'm Dr. David Burns. I'm an anesthesiologist and director of the Interventional Acute Pain Service. The continuous nerve block you have is a tiny plastic catheter infusing local anesthetic to the nerves that control the part of your body where surgery was performed. We will send you home with a disposable pump that will continue this infusion for several more days. This way, we can keep you comfortable at home without having to use a lot of narcotics, and thereby avoid or reduce their undesirable side effects. In this video, I'll explain to you how the pump works and how you can customize it for your needs as you recover at home. The OnQ Pump is basically a local anesthetic-filled balloon with tubing that connects to the flexible plastic catheter in your body. It only contains numbing medicine. There are no narcotics in the solution. It has a dial that controls the infusion rate, as well as a squeeze button that allows you to give yourself an extra dose of numbing medicine as needed for breakthrough pain. There is also a clamp that you can use to shut it off completely if wanted. However, this is usually just left open once it's connected to your catheter. The rate dial allows you to control the amount of numbness you want in the area being blocked. It has a range from 2 to 14 milliliters an hour, but a number must be showing on the display for the cover to close properly. Some patients like to turn it up at night to ensure they get a good night's sleep, and then turn it down during the day because they want more feeling and function in their limb. And some patients prefer the opposite, having a higher infusion rate during the day when they're more active to help cover the soreness from physical therapy, and then turn it down at night when they're not moving it as much. It's totally up to you. If you feel too numb, turn it down. If it's not enough, turn it up. Just remember two things. First, it is infusing a long-acting local anesthetic, so the effect of changing the rate can take time, maybe an hour or more. So if you're hurting and you need more numbness, the squeeze button will be faster. With the button, you usually will feel better within 10 to 20 minutes. The other thing to remember is the higher you keep the rate, the faster the pump will run out. But use what you need to use so that you're not suffering. To help you know what to expect, the balloon holds about 600 milliliters of local anesthetic. So if you keep the dial at 10 mils an hour and never change it and never use the squeeze button, it will last you 60 hours. If you keep it at 6 mils an hour, you could have nearly 5 days. But if you keep it at the max rate of 14 mils an hour, it would only last you less than 2 days. This squeeze button is available to you if you have breakthrough pain and need a little extra numbing medicine. Simply squeeze the button on the demand bolus device and it will give you 5 milliliters of additional local anesthetic. As this automatically refills, it makes a clicking sound, providing you an extra dose of numbing medicine every 30 minutes. However, if you are using it frequently, you may be better served by turning up the rate some to maintain a better level of numbness. But also, keep in mind that the nerve block may not be able to relieve all of your pain, so you may need to take some pain medications as well. These medications, which may include narcotic prescriptions, are prescribed by your surgeon. They are not provided by the Acute Pain Service. Remember, be careful with your limb while it is numb. You may not feel it if you pinch it in something, or if you put something too hot or too cold on it. If it's your leg, don't try to bear weight on it alone, because you may fall. Even if you feel that it is not causing you weakness, just having surgery on your leg can make you unsteady on that limb for a while. So have someone assist you when you stand on it to ensure that you don't fall. Keep the bandages over the catheter clean and dry. There may be some fluid leaking at the insertion point, and that is normal. As long as enough is getting in to keep you comfortable, it is of no concern. If it is leaking and you're not comfortable, you may need to turn up the rate to compensate for the leak. The medicine in the pump typically lasts about 2 to 3 days. During that time, a physician anesthesiologist or a nurse will call you to make sure you are doing well. After the infusion stops, you may still need to take some pain medicines as you continue to heal if you weren't already doing so. You can remove the catheter after the numbness is worn off and you have full feeling in your limb. The removal is very simple and painless. Simply peel off the dressing and the tape and the catheter just slides right out. If it doesn't want to come out, or if it hurts to pull it out, just leave it in place until you're able to speak to the anesthesiologist, and they can help you through that. Once the catheter is out, the whole thing can simply be thrown away. If you ever have serious concerns or problems, you can have the pain service call you by calling the operating room desk at 474-3232 and ask that the anesthesiologist on call be given your name and number. We hope that you have a positive pain management experience with your nerve block.